Good morning, good afternoon, good evening, wherever you are in the world. Welcome back. This is If Your Meds Could Talk, and this is Dr. Michelle White, your friendly pharmacist, your wise and beautiful pharmacist, your drug pusher, and your drug dealer, the right kind. Okay, so I hope everybody is thriving and striving during this COVID-19. You're doing well. I know some states have already started going back to normal, but I don't believe there's ever going to be another normal like we used to know it. And here in Ohio, we've extended the shelter in place, which I'm okay with that because I'd rather be alive and being able to talk to you than not. So I ask that everybody be safe, healthy, and wise. And today we're going to cover the urinary tract system. We're going to do this in two parts. So the next episode will cover the kidneys, but today we're going to talk about the urinary tract system. So let's get started. Are you ready? Are you ready? Are you ready? All righty. Well, one of the first things, the body fluid that we learned as a little girl or boy was what? It was pee or urine. And we all learned about utilizing the bathroom or being potty trained because of urine. And we were taught how to use the toilet instead of diapers at a young age. But as we get older, some of us, as we got older, it's amazing how adults sometimes return back to the child. And that's what's happening with my dad right now. He's incontinent because of what's going on in his brain. And therefore, but I'm blessed because he still knows he has to use the restroom, but we might not get there in time. So, of course, he's back into diapers, or what we call depends. So here we go, talking about the urine and the topic of urine and how the urine gets through your urinary tract. All right, so as we drink water or fluids, we drink a lot of water or we drink a lot of fluids. After a few hours, you're going to have to urinate. So the body produces urine, and this is a way to get rid of waste and extra water that it doesn't need. And so before the urine or the water that has accumulated that you don't need, before it leaves your body, it travels through what we call the urinary tract system. So your urinary tract is a pathway, and it has several parts. So we're going to talk about the different parts. You have, first of all, the kidneys. The kidneys are very important. We're going to talk about that in the next episode. You have two bean-shaped organs that filter waste from the blood and produce urine. Then you have your ureters. These are two thin tubes that take the urine from the kidneys to the bladder. And from the bladder, and what is the bladder? The bladder is a sac that holds the urine until it's time to go to the bathroom. And then you have your urethra. And your urethra is the tube that carries the urine from the bladder out of the body when you urinate. So the kidneys, let's go back to that for just a little bit. I just want to tell you how important your kidneys are. They do two important jobs. They filter the waste from the blood and produce urine to get rid of it. And if your kidneys couldn't do this or they don't function like they're supposed to, guess what happens? You get toxins, really bad toxins too. And as they build up in your body, they are going to make you sick from head to toe. You'll start swelling up and everything else because now you're not getting rid of the water or excess water. And one of the telltale signs that your kidney's not working, and sometimes your heart, is you get pooling of fluid in your ankles and your feet or your legs. Okay, so that's why sometimes you hear people that are on dialysis. They're receiving kidney dialysis, and that is a way to get rid of the toxins if they're a candidate for a kidney transplant. It's a measure to kind of a waiting cycle before they're eligible for kidney transplant. And sometimes some patients aren't even eligible for a kidney transplant. But we'll talk about the kidneys later. All right. So you might wonder, how does your body end up with waste and needs to get rid of it? Where our bodies, as we talked about before, we go through the digestive system, and then you go through the metabolism system with the liver, which we talked about. Well, that's where the water takes the water. Well, let me back up. The body needs what it needs, and that's the same thing goes with the water. Your body takes what it needs of the water, and then our kidneys are a way that the water is excreted out of our bodies through the urine. All right. So, have you ever been to the doctor and the doctor asks for a urine sample? Well, your urine sample tells how well your kidneys are functioning. And for example, if you got white blood cells in your urine, that means you have some type of infection going on. And one of the most common infections that we get is called a urinary tract infection. All right. So your urine is a way your body needs to keep the right amount of water. Okay. And so when you drink a lot of water, you notice the color of your pee. If your pee is pale yellow or real light yellow, that means you're drinking a lot of water adequately. Sometimes we could drink too much water, and we could talk about that later. And we will talk about that later, because your medications we'll talk about that. There's certain medications that affect your urine output. So anyway, so let's talk about what's pee made of, or what is urine made of. Well, your urine consists of several things. First of all, it's a sterile. When I say sterile, it's a sterile waste product composed of water-soluble nitrogen products. So what are those? What does your urine contain? One, of course, it contains water. Then it contains urea. And urea is a non-toxic substance in your urine. It's a waste product that forms when proteins are broken down. However, it's made of toxic ammonia and carbon dioxide. Now, those are toxic. All right. Then you have urochrome, and urochrome is responsible for the pigmentation blood products that give your urine a yellowish tint or yellowish color. And then you have your salts, and your salts may be sodium salt or potassium salt or chloride salt. And then you have your creatinine. And creatinine is just a waste product that forms with the normal breakdown of muscles. And when we talk about certain medications, they're going to affect your creatinine clearance. And when I worked in the hospital, I always wanted to look at the renal panel of a patient based on what type of drugs they were taking. Because if their kidneys weren't functioning too well, that drug could accumulate if the kidneys was not clearing the drugs. So again, we're going to talk about those things. And then you have the byproducts of the bile from the liver, and of course, ammonia. And I'm going to talk about ammonia for a little bit. I told you I was a caregiver of my father, and he soils his clothes quite often, as well as the bedding or linen. And so therefore, you have to change that. If I let it sit for a while, I'm going to smell ammonia. And we're going to talk about why that happens. So do you have it? You got it? Okay, let's keep going. All right. So once your urine is produced, it travels from the kidney to the bladder, where it's stored until you need to go to the bathroom, as we said. The bladder expands as it fills, and when it's full, there's nerve endings in the bladder wall that sends a message to the brain that it needs to urinate. Okay, so when you go to the bathroom, you're ready to go. The bladder wall contracts, and the sphincter, which is a ring-like muscle that guards the exit from the bladder to the urethra, it relaxes. Okay, it relaxes. So in males, the urethra is at the tip of the penis, and in females, it's at the front of the vaginal opening. All right. So you may not think too much about urinating or your urinary tract infection or your urinary tract. Look, I'm getting ahead of myself. But it is important that you should know two things. One, you need to drink a lot of fluid. If you don't drink a lot of fluid, and especially water, guess what? You're going to get dehydrated. And once you get dehydrated, your body's going to react and it's going to respond to that. Number 2, it's careful. You need to be careful about your hygiene around that area. So for females, we've all been told to wipe from the front to the back, especially after a bowel movement, because the bacteria from your bowel movement can actually get into the urinary tract system, and therefore bacteria could invade your urinary tract, and therefore you got urinary tract infections. The same goes with males, okay? However, well, the males, I'll take that back. The males got a little bit better than we do. Our pipes and our different functions of different areas down there, the males have it better than we do. Females, we have to wipe that way so we won't get urinary tract infections. And then for everybody, and that's males and females included, it is important not to hold your urine. You know, when you're in a tight and you're like, oh, I'm in the tight, you're trying to hold it. Or you're at work and you're like, oh, I got to type this last thing, or I got to read this last email, and you holding it. Well, that's not good, y'all. It's not good because it leads to a urinary tract infection. So, especially in us females. Again, us females, we can't afford that. So when you got to go to the bathroom, get up and go. Don't wait. All right, so I'm going to give you some key takeaways about your urine. We're going to talk about the color and its indication for hydration, the pH. We're going to talk about the smell, the turbidity, and those are some characteristics of your urine. So physical characteristics that can be applied to your urine include color, turbidity, which is the transparency of your urine, the smell or the odor of your urine, the pH, whether it's acidic or alkaline, and the density. All right, so this is good for you to understand when your urine is a certain color or it's not. You're wondering, okay, why does my urine smell like this, or it looks cloudy or whatever. We're going to go through that. So let's start off with color. So color, typically your urine should be a yellow amber, but it may vary depending on what you're eating and the concentration of your urine. The more water you drink will reduce the concentration of your urine. It's going to be lighter. The darker your urine is, it's an indication that you're dehydrated, okay? And if you see red urine, that means you have some red blood cells in your urine, which indicates you may have kidney damage or some type of kidney disease. Now, there is something else that may cause your urine to become red or pink, and that is if you eat beets, which I just started doing since we've been on this lockdown. I'm trying to eat healthier. I'm doing a lot more juicing, so I'm including beet in my juicing. And I'm like, the first time I did it, I was like, why is my urine looking like this? It kind of alarmed me. And I was like, OMG. But my mind, that brain went into motion and it said, no, remember you've been drinking and you've been drinking beets. So therefore my urine turned colors. All right, smell. The smell of your urine may provide health information, good health. For example, if you're a diabetic, your urine may smell sweet or fruity. And you all are saying, Michelle, nobody get down in the toilet and smell their urine. Well, sometimes you might want to think about that. Because if it does smell fruity or sweet, that's an indication that you have some ketones in your urine. And it's glucose that's spilling over into your urine. And generally, fresh urine has a mild smell. But aged urine, like I was telling you before about my dad's soiled clothing or bed linen, it has a strong ammonia odor. Well, that's when you know the urine is old. So if I left your urine in a container, sometimes I do, overnight in his urinal, and I smell it the next day, it's going to smell like ammonia. All right. So the pH of your urine is between 4.6 and 8. And this is typical, and usually the average is around 6. So why is that important, Michelle? Well, If your diet is high in proteins, then your urine is going to become more acidic. But if you're a vegetarian and you eat a lot of alkaline fruits and vegetables, then your urine is going to be more alkaline. One of the things that I do on a regular basis is I drink alkaline water. And the pH is usually about 10. Whole Foods, you can go to the machine and they'll indicate what the pH of the water is. I fill my jugs up if it's 9. I just like to drink more alkaline water to bring my urine as well as my whole entire body back to a normal pH, or at least the regular pH, which is 7.4. All right, the density is the specific gravity. And I'm not going to get into detail about that because there's a range and you'd be like, okay, Michelle, what does that mean? But basically, let me define it. It is the ratio of the weight of the volume of a substance compared to the weight of the same volume of distilled water. That will be important for your urinalysis for that med tech to describe, okay, the density of his urine was blah. All right. And there's a normal urine range, and it ranges from 0.001 to 0.035. In case you ever get your urinalysis and you're looking at the density and it describes that, you'll know what it means. All right, and then we get into turbidity, and that's where I talked about the transparency of your urine sample. And your urine sample it's either going to be reported as clear, it's going to be reported as slightly cloudy, opaque, or flocculent. Okay. Normally, fresh urine is either clear or very slightly cloudy. Excess turbidity results from the presence of suspended particles in the urine. And usually, sometimes that cannot be seen, but under a microscope, you could see the sedimentation. And common causes of abnormal turbidity or the cloudiness of your urine, they include increased cells. You might have a urinary tract infection, so therefore you got some bacteria, usually a lot of bacteria. And the bacteria usually, and we're going to talk about infectious disease later, is usually E. coli. And E. coli usually is from where? Your bowel movement. All right. And then the other thing that might cause your urine to look turbid or not transparent is obstruction of your kidneys. So those are some key takeaways about your urine. And I always want to leave you with some golden nuggets. And these golden nuggets are just foods that you might want to incorporate in your diet. There are 10 of them. And some of these you might already eat. You may already have them incorporated in your diet, but I'm going to go through them so that you will jot these down, add them to your grocery list, incorporate them in your diet. All right, so the first one is celery. And celery is known to remove toxins, waste, and contaminants from your body. Did y'all know that? We used to eat celery. So when you get your chicken wings, y'all, get your celery and your carrots. Not the French fries, but get the celery and the carrots for those who serve that, okay? Blueberries. We've been talking about blueberries a lot. And I've been incorporating blueberries a lot into my diet lately. And fortunately, blueberries have a lot of antioxidants in it, and it's good for your bladder and good for it's healthy for your it's clean. It promotes clean and healthy bladders. Okay. All right. Asparagus. How many of y'all like asparagus? Well, it's good right now. If you don't have these in your diet, it's a good thing to explore, especially that we're sheltering home. It's a good time to explore new types of vegetables. We didn't eat asparagus back in the day when I was growing up, but now I love asparagus. And I like to grill it with some olive oil and a little butter and sprinkle it with some sea salt and some pepper. Voila. And asparagus is very good for your bladder and kidney health. Okay. It actually is good to prevent anemia due to folic acid deficiency. And also, let me add to this, when you eat your asparagus, beware that your urine is going to smell just like what you ate, the asparagus. All right, Cauliflower is next. It is high in nutrients, vitamin C, vitamin K, and vitamin B. And that's all I'm going to say about that. So garlic. Garlic. I love garlic too. I use a lot of garlic in all my cooking. That calls for it anyway, especially my meats and chicken and anything. I love garlic. So garlic is an effective food for reducing inflammation. It's a good way. It works as an antibacterial. And some of the countries, I had a good friend from Haiti, and she was like, no, she was from the Bahamas. I call her Mother Brown. Mother Brown said, Michelle, I actually gave a doctor friend of mine that I worked for, and I just boiled some garlic, and I gave him this garlic juice because he was about to die. And he kept drinking the garlic juice, and before you know it, he was revived. He was much better. So there's something about this garlic, y'all. Y'all know the vampires didn't like garlic. But anyway, that's another story. Black beans. Black beans is good for fiber, but it is also good for your kidneys and your urinary tract. Okay? All right, kale. Kale, all of a sudden, over the last 2 to 3 years, some of y'all probably been knowing kale for a long time, but kale has been introduced into the food chain. And kale is very good because it is packed with vitamin A, vitamin C, and it really keeps your bladder and your kidneys healthy. Sea bass. Sea bass contains healthy fats called omega-3s, and it works by keeping the kidney, the potassium sides, and adjusting the phosphorus binders, and it keeps your kidneys in good, healthy. I didn't know this either, but it keeps your kidneys healthy. So incorporate some sea bass into your diet. Onions. Onions is another thing. If I'm not adding a garlic, I'm adding some onions. Onions contain sulfur compounds, and that's why it gives this smell, but it's very good. It's a great antioxidant, and it's good for your kidneys, and it's good for your bladder. And then finally, egg whites. Egg whites provide an effective kidney-friendly source of protein, more so than the egg yolk. So instead of sometimes frying that egg yolk, separate it and fry your egg whites instead. All right? So, those are my golden nuggets for today. I know it took a little bit longer than what we normally do, but I hope you enjoyed the podcast. Come back. This is Dr. Michelle White with If Your Meds Could Talk, and we'll see you soon. Bye-bye.